brand awareness to brand relevancy. That's got a ring to it. I really like that.
I could say you probably know of 50 brands, maybe more, but you use 5 and you're loyal to 5. So those brands have relevance. The other brands are just you're aware of. So, we used to say, years ago, like, especially in healthcare marketing, well, we care. We really care. We really care a lot. We care a lot. We care more than anybody cares. It's sort of like thinking of an ad campaign where you would have your medical staff on billboards and the tagline would be, all of our physicians have licenses. It's the price of admission. I expect you to have a license. I expect you to be good. Can you be relevant in my life? Can you be relevant in my 94-year-old mother's life? Can you be relevant in my 27-year-old son's life? And how do you do that? So, that's kind of where different types of segmentations come in. I even call them health personalities. What is the health personality of my young son? What is the health personality of my elderly mother? They're very different health personalities.
Yeah.
What's the health personality of that household? And who's in that household? And that's really having consumer come in. That's really behavioral science coming in. And we're professional communicators. We're the best people in the company to know and be able to articulate that.
Yeah, we really are. I truly believe that. I feel like we know patients and healthcare consumers better than anyone else in the organization. We connect with them and engage with them more often than, in most cases, the clinical team. Clinical team sees them a couple times a year. A lot of the engagement touch points involved are automated. They are tech-driven, and so they're not even necessarily people-driven. We have the opportunity to really put that knowledge to use,
Yes.
And it kind of leads me to this final thought of really what I hope a contemporary marketer is in healthcare. It really is somebody who understands the opportunity. You were saying right at the beginning, you see this as an opportunity. I hope we understand what that opportunity is to truly impact the health and well-being of those around us by connecting them with answers. And I would say not even just connecting them with care, because sometimes what we need is just an answer to something, and we actually don't need to see a professional. So we don't need to actually go schedule an appointment. So even connecting with care doesn't quite get us that full way of seeing what the vision is of what we can do. So I just like to think, man, if I go in every day and say that's my role, that's what I can do. I can impact lives literally by connecting people with answers about their health. I don't have to worry every day when I wake up, what am I doing?
I think what you're talking about, Jared, really is building relationships.
Yeah.
You're talking about there's nobody better qualified in the organization to see this individual as a relationship, not as a procedure, not as an appointment, not as a follow-up, but as a relationship. And how do we capture that relationship? And that's brand relevance. That's building loyalty. And while I'm very metric driven, and I think the data and analytics are important, I think what's more important is it's not the technology, but it's where the technology exists. It's the opportunity that the technology exposes. It's the value that the technology brings. It's the consequence of the technology, not the technology itself. And the contemporary marketer needs to see all of those pieces and say, how do I use this to build a relationship? How do I make our website where if you have a personal login and you're part of a system, that every time you read an article or you click on a piece of information, your own personal home page changes based on your search history. So it automatically automates itself to you. That's, I used to say all the time, you can put your logo, on a million pins, but you can only personalize one. And Amazon is said to have, I don't know, like 300 million segments. They said, we don't have segments. It's a segment of one. You are your own individual segment. And I think, we're in the most, healthcare is the most personal business in the world. We need to start thinking about that kind of personalization and building relationships and saying, I can build relationships with people in this community.
What a good way to kind of point all this in the same direction. I just love that thought, and man, this is fun.
It's great.
This is good. We ought to do this again sometime.
Let's do it again. Absolutely.
Yeah, we're gonna keep talking about this. There's a lot to be said.
There's a lot to be said. It's like I said earlier. It's an exciting time. It's an incredibly exciting time, and let's help the contemporary marketer seize the opportunity.
I'm there, man. Let's do it.
All right.
All right.
Good.